Chronic lower back pain is a very common condition. It's very expensive to diagnose and treat. It's very expensive because it's a reason for lost productivity and disability in adults. The most common source of chronic low back pain, and our research here, as well as research from other institutions, has confirmed this, but the most common source of chronic back pain is a disc. Not just a degenerated disc, but one that has an internal injury. The disc itself was more commonly painful in younger adults as compared to older adults. In the older adults, we more commonly see a joint as a reason for chronic back pain, a joint like what's called a facet joint or the sacroiliac joint. Symptoms, folks come in with a complaint of back pain. My back hurts, it aches, it's burning, it's here, it moves over here. So those are the symptoms, and it's not really a true sign of back pain other than certain physical exam findings can suggest one structure over another. But disability or the inability to function normally is a hallmark of chronic low back pain because we can't do anything in our daily activities that doesn't load our spine, and when that happens, the symptoms can escalate and fluctuate, but they're always there, and that's a hallmark of chronic low back pain. Diagnosing the source of chronic back pain is challenging for multiple different reasons, but in order to do so successfully, the clinician needs to bring together a variety of pieces of information. For example, the patient's age, how the symptoms started, where exactly the back pain is located. Our research has shown that the location of back pain has a predictive value in determining where it's coming from. Certain physical exam findings can help us hone in on a source for the back pain, and then imaging findings on MRI and X-rays and CT scans can help clarify the picture to a degree, but oftentimes we have to utilize precision X-ray guided diagnostic blocks to determine the source of symptoms, so then we know where to treat or what to treat and how to treat it. And that's kind of a outcomes-oriented approach to diagnosing and treating chronic back pain. Once back pain becomes chronic, so a patient can have flare-ups and they come and go. That's where things like physical therapy and certain medications are important. But once the symptoms become chronic and limiting on a daily basis, then we're at a point where we have to figure out where it's coming from and treat it more definitively. Patients who have a painful disc may respond to injections of steroid around the back of the disc, especially maybe if it's herniated. If those folks do respond, the symptoms can stay reduced for some period of time, or they might have a relapse. And in that instance, hopefully, they respond similarly by repeating the injections. Patients who have a painful sacroiliac joint can respond well to steroid injections into the sacroiliac joint. And then patients who have a painful facet joint, a neurotomy procedure is indicated there, and those patients typically do quite well after neurotomy for facet joint pain.